everyone. We have medical and surgical asepsis, wound irrigation, and dressing change. I'm Shay. We have Gavin and Laura. Alright, to start out with, we have medical asepsis. Medical asepsis, or clean technique, involves practices to reduce and control the spread of pathogens to prevent infection. The goal is to minimize the risk of spreading infectious microorganisms, particularly in the clinical and healthcare settings. This prevents healthcare-associated infections, protects both patients and healthcare workers, and it's essential for safe and effective healthcare delivery.
And then we have a video that we're going to do for surgical asepsis. It's going to be donning sterile gloves.
Hello, we are going to be doing sterile gloving today. First things first, we're going to do some hand hygiene. We can wash our hands with soap and water, or we can use hand sanitizer, whatever is the preference of the day. First things first, we're going to open our packaging. These are small, so I'm going to open them and get them out, but we're not going to be using these today. We're going to loosen them up. And then we're going to toss them to the side because we're going to be using each one, all right? So first things first, we're going to open it up. And then, now that we're in this position, we're going to open our flaps, trying not to touch the inside. We have a 1-inch border that's in the sterile field. So we'll go like this. And this one is a little used and abused, so we're going to, we go like this, but we're going to push this down so it doesn't fold in on itself. We wouldn't do that in a real life scenario, but we're still in the sterile field. We did the hand hygiene. Now that it's open, we'll do our dominant hand first. I'm left-handed, so I will do the left hand first. And we're going to grab this from the outside, and we're going to fold, or push our hand in like this. Just like that. And then this one, we're going to dig our hand under this glove. Just like that. We go in. Try not to adjust it. You might have some errors, but we'll go like that, and we're done.
All right. For that video.
Alright, moving on to surgical asepsis. Surgical asepsis, or sterile technique, is a strict protocol to eliminate all microorganisms from the area. It's crucial for invasive procedures. The goal is to achieve a completely sterile environment to prevent infection during surgical and invasive procedures. It is critical for preventing post-operative infections. It protects both the patient and healthcare providers during invasive procedures, and it's essential for patient safety and successful surgical outcomes.
All right. And we have some strengths and weaknesses for both. So on the left we have medical, on the right we have surgical. Some strengths for medical asepsis are that it's much simpler and quicker to apply compared to surgical asepsis. And it typically involves basic practices like hand hygiene, wearing gloves, and disinfecting surfaces, which can be done without extensive equipment or preparation. Some weaknesses for medical asepsis is it reduces but does not eliminate pathogens. So that's the big thing here that differentiates medical and surgical. That's the main thing. And then it's not sufficient for invasive procedures or settings where the risk of infection is high, such as surgeries or catheter insertions. Some surgical sepsis strengths are, number one, it is the gold standard for infection prevention during invasive procedures, and it completely eliminates microorganisms, ensuring that no pathogens are introduced to sterile sites. This is very critical for surgeries and inserting things like catheters. Some weaknesses involve the extensive preparations it takes to do surgical sepsis, including the sterilization of equipment or instruments, preparing the surgical team, and maintaining a sterile field. This can be time-consuming and requires careful attention to details. Also, maintaining strict sterile techniques can be challenging, and then unintentional contaminations can happen, which can compromise patient safety, which is very bad. For wound care, some important things to know. We have 3. So number 1 is going to be preventing infection and complications. Proper wound care is essential to prevent infections, which can lead to serious complications like sepsis or tissue necrosis, especially in chronic wounds. Number 2, wound care promotes faster and effective healing. By maintaining a clean, moist environment, wound care promotes faster healing, reduces healing time, and prevents wounds from becoming chronic. And lastly, number 3, reducing pain and improving quality of life, effective wound management, minimizes pain, discomfort, and scarring, improving the patient's quality of life, and reducing the risks of long-term tissue damage.
Okay, now we're talking about wound irrigation. So it's a technique that involves gently flushing a wound with a sterilized solution to clean it of debris, exudate, and microorganisms. The goal is to promote wound healing by reducing the bacterial load and removing contaminants, thereby preventing infection, help clear debris and bacteria, promoting cleaner wound bed, reduce infection risk and facilitate the healing process, essential for wounds with a high risk of contamination or infection. So for this one, we're going to use a saline 0.9% sodium chloride.
And then we have a video for our wound irrigation that we will present.
So I'm going to grab my sterile wound kit and create my sterile fill. In order to do this, you would also be wearing a gown and goggles to prevent yourself from getting any splatter. We have our sterile flush, our new dressing, we have tape, some new gauze, and then another Chuck's pad which will go under his arm. First things first, I'm going to be removing his dressing that he already has on. And we're going to be looking at the color, and then setting that off to the side. And I'm going to grab my sterile flush. And we're just going to be flushing the area to make sure it's clean. Alright, and then we're going to take new gauze and dry off the area. After it is dry, we're going to take another set of dry gauze, set it on the area, and grab our new Band-Aid. Okay, so I have my new bandage that we're going to be putting on. We're just going to open this up, and we're going to put it on right over the new gauze. Alright, and then we would also be making sure to put your name, date, and the time that this dressing was changed.
All right. So currently, a study was done, and 8,000 nurses are wound care certified in the United States, and then 13,000 physicians practice wound care here in the United States as well. Just some numbers, maybe think about going into this field once you graduate.
Type of wound dressing, we have 6 common types. The first one is gauze dressing, that we had the transparent films, hydrocolloid dressing, and then we had the silicone dressing, antimicrobial dressing, and then the collagen dressing.
And once again, there's many different types of dressing. These are just common types, so you don't need to get into the logistics, but just knowing that there's multiple types, and these are the common. We use the gauze and the transparent in our video, but depending on the type of wound, you might use different ones and so on. And the healing process.
Okay, and then for dressing change, dressing changes require aseptic technique to prevent infections at the wound site, promoting healing and reducing the risk of complications. The goal is to maintain a clean and controlled environment around the wound to prevent the introduction of microorganisms. This prevents wound infection and promotes a overall faster healing. It's essential for patients with compromised immune systems, and this also reduces the risk of healthcare-associated infections.
And then these are our citations. They're all APA format. And then thank you very much. Our hand in. That did not happen. We're gonna hold this down.
That
And then
he
we're
already
gonna-
has on. now have our new Band-Aid. How does this open? Hold on, we're gonna have to cut it again. How does this?
right
I
there.
can't do any. Hi everyone, we have medical and surgical asepsis.
Go like that, and we're done. All right, so that video is done.
Okay, and 5.
Ignore that. Infection prevention during invasive procedures. It completely eliminates microorganisms.